If your artificial hip is failing, your surgeon may have mentioned a second operation called revision hip replacement. A revision replaces artificial hip parts that have loosened, worn out, become infected, or failed after your original hip replacement. Loosening and wear are common reasons. Tiny debris particles from the moving parts can trigger bone loss around the implant. Infection, repeated dislocations, or a fracture around the implant are other reasons revision may be needed. Doctors assess the hip with X-rays, CT scans, blood tests, and sometimes a joint fluid sample to check for infection. When there's no infection, surgeons usually perform a single-stage revision, removing old parts and inserting new ones in one operation. For serious infection, surgeons often use a two-stage approach, first removing the implant and placing an antibiotic spacer, then implanting new parts once the infection clears. When bone has been lost, surgeons may use longer stems, modular implants, bone grafts, or metal augments to rebuild the joint. Surgery usually takes 2 to 4 hours. Most patients stay in hospital about 5 to 7 days for pain control and early movement. Recovery is gradual. Patients move from a walker to crutches to a cane, guided by daily physiotherapy over several months. Full recovery can take up to a year, with strength, balance, and endurance continuing to improve well beyond the first months. Revision surgery carries higher risks than the first operation, including infection, dislocation, blood clots, and leg length differences. Low-impact activities like walking, swimming, and cycling are usually possible again. High-impact sports are generally discouraged after revision. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.